Hey everyone, it's me, Dr. Whimsy, and today I decided to have a really quick conversation about some of the natural treatments we do here in my offices for depression and anxiety. And when it comes to treating anxiety and depression, I have found that there can be multiple causes, but one of the first things that I see, and this is something that I see in Los Angeles, but I see it pretty much all over the country, and that is depression and anxiety that's associated with overwork, simply people that are doing too much. I've talked about this in previous videos when I've talked about minimalism in medicine, that doing too much, trying to do too much, overwork, lack of sleep can in and of itself cause a lot of health challenges. Sometimes the first symptom that you have a health challenge is that you simply feel depressed or tired or have a lack of enthusiasm about your life. So we start with the basics. We check to see if a person is getting adequate sleep. Even if a person is getting 8 hours of sleep a night, it may not be good quality sleep. There are, of course, some simple things you can do to help have a better night's sleep. And if you want to find out more about that, you can check my previous videos. So we talk about the sleep quality. We also talk about the diet, making sure a person has stable blood sugar. Believe it or not, some types of depression and anxiety are associated with hypoglycemia and diabetes, pre-diabetes. And there are patients I've had who had diabetes, type 2 diabetes, and didn't even know it until we ran lab work. So something as simple as blood sugar dysregulation can have an effect on mood, and sometimes one of the main symptoms is panic attacks. A person's having panic attacks because they're having changes in their insulin levels, and it can induce feelings like a panic attack. Sometimes it can be due to hypothyroidism. That's another common condition that gets underdiagnosed. One of the reasons why hypothyroidism is underdiagnosed is because it's subclinical, where we check what's called a TSH, and we find that the TSH may be elevated, but it isn't quite elevated enough in order to trigger a diagnosis for hypothyroidism. So once we found out why a person's depressed, whether it's overwork or lack of sleep or blood sugar dysregulation or thyroid disorder, or maybe it's simply something going on in their personal life, we always try and find the least invasive way and the minimalist approach to treating the condition. The other great thing about being a well-trained naturopathic doctor is that I can work with just about anybody without interrupting whatever protocol or treatments their doctor currently has them on. And that's what makes naturopathy so great. Not only that, but if you are a naturopathic doctor and you are trained to work with primary care physicians, you can not only offer treatment programs that don't interfere with what your doctor is already doing, it may actually support and enhance the treatment your doctor is offering, and that can help your doctor do his or her job better and make what they're doing be a treatment that's more effective. I'll give you an example. If you have a patient who comes to your office and they are suffering from diabetes, and the doctor may be wanting to prescribe some type 2 diabetes medication like metformin, it's not enough to just assume that if the patient is taking their medications properly as prescribed and assume that there will not be a progression of the disease if the underlying cause of the disease has not been addressed. And so for that reason, a naturopathic doctor would be working alongside your doctor to make sure that your diet, nutrition, and lifestyle are appropriate so that we don't see a progression of the disease. The same is true when we're treating anxiety and depression. If we can find what the underlying cause is and work with your primary care physician, we can create an integrated program that not only enhances your current lifestyle and diet and medication choices, but actually can improve them. All right, this was a brief video just to tell you a little bit about how we treat anxiety and depression in my offices. My name is Dr. Whimsy Anderson. If you'd like to make an appointment, you can do so by going to drwhimsy.com and clicking on the Book Now button. If you are not in the Los Angeles area, then the good news is I do see people for telemedicine appointments. That's for general coaching. And I'd love to have you check us out, and hopefully we can do some stuff to help. Thanks for watching, everyone, and take care of yourselves. Bye-bye.